Azar, physical therapist. Today we're going to talk about the foot problems and the foot alignment and how we can recognize them and how we can correct them. Foot and ankle is very important part of our body, which takes all the body weight and help us with balance, normal walking, and giving proper alignment to the other joints in the lower extremity like knee and hip and even lower back. So as we know, ankle is a saddle joint and it can do a lot of movements. So it's a very aerodynamic joint. It has a lot of good mobility that we should talk about. The first movement of the ankle is dorsiflexion, which we're going up like this, the toes towards the ceiling. Another motion is plantar flexion. We're going down like this, toes to the floor. Then we have adduction, adduction going in and abduction going out. We also have a circulation, circular movement we can do. And we also have movement on the heel. As you can see, the heel can go in and I can go out. In and out on the heel. And when the heel goes in and out, it's like a hand that we have a supination and we have pronation on the forearm. And the foot, the same thing. When the heel goes in, we have a forefoot supination, which the inside of the foot gets off the floor. And when the heel goes out, we have a pronation, which inside of the foot, which is a curvature, falls on the floor. So people that are flat foot, they're usually overpronating because the curvature of the foot is located inside the foot, and when they do that, the arch falls and they put a lot of pressure on the inside of the foot, and they walk like that. If they walk like that, as you can see, a lot of problems can happen in the knee. The kneecaps can get in, and the even hip can get internally rotated. So a lot of issues down the road can happen on the whole lower extremity. And sometimes we compensate, sometimes because that heel is too much in or out, which is usually going too much in, since they don't want to walk like this, with the forefoot gets a little spiral movement and compensate for that, and then you can see this part's a little out or in, but the forefoot's doing the opposite thing. So usually when the heel goes in like this, the forefoot does that, overpronates. So we call it secondary flat foot or overpronation. So even though if it's a secondary flat foot, still considered as kind of flat foot, but it's a different approach and different treatment for that. In the physical therapy, we're usually mobilizing the heel first to make sure the rear foot is having enough mobility, good mobility, and then it can sometimes correct the forefoot, and forefoot doesn't have to compensate if the rear foot is corrected. In very rare cases, the rear foot can be surgically corrected, and then the forefoot can follow that. But most of the time is the physical therapy and exercises, and also the good insoles. So that's the orthopedic prosthetic people come in play, and then they give you good, or podiatrists. Podiatrists can give you very good insole and then can correct that. Now I want to talk about the flat foot and too much curvature. Flat foot is when your arch is falling, all the bones and the small bones on the ankle fall down, and as you can see, the inside of the foot, which has to have a normal curvature, at this case doesn't have curvature anymore that much, and then the plantar fascia gets too much overstretched, and the muscles of the intrinsic, which they are located, the small muscles located on the sole of the foot, gets overstretched and weak. So obviously the first thing we should do in the flat foot, we should strengthen the intrinsic of the foot. That's exactly what I'm doing right now, picking up things from the floor. I'm telling my patient, if you want to pick up things with your hand, instead of doing that and hurting your back by bending over, doing it with your foot, curl your foot and pick up stuff. That way you can also help your intrinsic muscle of the foot to get stronger, so you can overcome your flat foot. So very, very good strategy. You can even do it this way if you don't have anything to pick up. Just curl the toes, hold for 5 seconds and relax. And that way you can strengthen the intrinsic of the foot and give a good tension to your plantar fascia, which is loose also. Another thing you can do, bone mobility. You can mobilize these small bones to get pushed up. So what we can do, we can put a water bottle in the refrigerator, and then as you can see, I'm trying to push. For that matter, you better to stand up, so you can really press these bones up to try to make more curvature. I don't need it because I don't have flat foot, but I'm just showing you. And the tennis ball, that's my friend. Tennis ball even gives you a very better pressure if you really want to mobilize your bones up to make a curvature. So you really need to do it in standing. Better to do it in standing and try to press that bone up. Especially inside of the foot, you have to be more on inside of the foot to build that curve and push the bone up. Also, these people have lack of plantar flexion strength, so you can give them a lot of plantar flexion strengthening. Okay. You can have them walk on the toes. That would be a very good exercise for them. Toe walking, strengthen the plantar flexion for them. And one more important exercise is a short foot. So short foot exercises, that's what you bring the inside of the foot off the floor, hold it for 5 seconds and relax. That way you control that overpronation and you encourage them to supinate with the foot. They can even walk in that position. Walk with the supination like this. Okay. Another recommendation for these people to have a little bit of a heels. Not the high heels, but they benefit from having a little bit of a heels on their shoes. So make sure they don't have a flat shoes, they have heels, and make sure if they go to get the insole has to be thicker in this side, so to push that bone up to build the curvature. Sometimes the flat foot can be normal though. If they are less than 3 years old, if you see the kid walking around like this, most likely is not a problem, because the kids before 3 years old, they have a normal flat foot because the intrinsic muscles are still weak and they couldn't develop the curvature. So after 3 years old, though, if you see somebody walking around like this, adults, that's most likely a problem. That's most likely a settled flat foot that we have to treat if we don't want later issues. So that's most likely about flat foot. So you have to be very careful if you're having a kid more than 3 years old and still walking around with the very flat foot. Then you have to go to the doctor. Podiatrists are good. Physical therapists definitely. A lot of home exercises, as I explained to you, they are helpful too. So, but if you feel that somebody is having a high curvature, what we should do? We call it pes cavus. The flat foot's pes planus, that's the medical term. And the pes cavus is for people that they have high curvature, kind of like me. I have a high curvature. Some people say, oh, we have a normal curve, that's great, but sometimes not too great to have too much curvature also, because a lot of things can happen. First thing, this point and this point, these are the 2 points that they get the body weight only, because this is not participating, the curvature is not participating in any weight pressure. Even in weight bearing, you still have a very high arch. So all of the weight of the body goes to these 2, so you can develop calluses here, calluses there, and you can also develop a long-term bone spur in the heel spur. And then you can develop a morton neuroma. So we have a nerve passing through here between that metatarsal bone, that because of the pressure, this nerve can get under pressure, and you can get numbness and pain on the toes. You can also get the mallet toes like me. The mallet toes is like when they're having a little bit of a flexion, when they are not straight. So why this happens? Because you don't have enough dorsiflexion. For the people that they have high arch, they usually have a very tight calf muscle and very tight plantar fascia, because as you can see, plantar fascia is attaching here to here. If it's too tight, if it's too much curvature, that can get too tight. If the plantar fascia gets too tight, it's attaching here, and it can get very painful. We call it plantar fascialis. People get up in the morning with a very stiff foot, and the first steps after get off the bed is a nightmare, a lot of pain, and they have to release that pressure. So if the plantar fascia gets tight, or if they have a bone spur and heel spur, that's a problem, and also the mallet finger, because when they have a dorsiflexion lacking, they have to overuse that toe extensors. So when toe extensors are overused, you can see how they are always fired like this, and then these toes can get like flexed in here and extend in here. That joint can get extended and that joint can get flexed. It's like this. They kind of stay like this. And this is the way that they can develop like calluses here. If you have a shoe that the box of the shoe is tight, here that IP joint, when they push to that box of the shoe, they can cause a callus in here. So we can callus in here, callus in here, callus in here, a lot of pressure here, tight plantar fascia, plantar fascialis, tight calf, a lot of things. So we have to really treat that one too. So how we can treat that one? Again, this is going to come in play, especially for people that already developed that plantar fascialis. If they have a plantar fascialis, this is the friend. Not this time to push the bone up. You just try to relax the plantar fascia and get rid of the inflammation and tightness of that plantar fascia and scar tissue there. You can also use this. You probably don't have to push too much because you're not trying to mobilizing the bone up. You're just trying to get the whole plantar fascia flexible. You don't even have to go inside that much. You can go everywhere and try to loosen up that plantar fascia, just like that. You don't want to really strengthen the intrinsic muscle, because if you do that, you're going to make it tighter. So that's a no-no. So you don't want to do that. You don't want to do too much plantar flexion, because you already have a very strong plantar flexors and tight calf. So what you want to do, you want to do the dorsiflexion. So a lot of dorsiflexion. Dorsiflexion exercise, you can walk on the heel this time, not walk on the toe, walk on the heels this time to strengthen the dorsiflexion. You can stretch the calf, very important. Calf and plantar fascia both needs to be stretched out for people with the high curvature or plantar fascialis. So you're gonna do this, stretch everything, stretch your calf, your plantar fascia, hold it for 30 seconds. Relax it. We can do up to 5 times a day. What else we can do? You can grab if you have a wedge, do it on the wedge. If not, that's okay. So you're gonna stretch the calf like this. You see how I'm stretching the calf a wedge? If you don't have a wedge, that's fine. You can do it in the edge of the book, edge of the step, or edge of anything. So I'm going to use this as something that has an edge, so I can stretch my calf like this, as you can see. Hold it for 30 seconds. Relax. And you can also do the calf stretching lunges, which is very famous. We already talked about it before. I'm stretching this calf on the back. Hold it 30 seconds and relax. So basically, we're almost doing the stuff the reverse to when we have a flat foot. So flat foot and high curvature, they're both causing problems. They are both somehow reversible if they're not bony, and if it's muscular, and especially if you're a kid or if somebody that's really not too old, we can reverse them. We may need insole for both of them. People with the high curvature, we need to have less heels. We shouldn't use the heels. I know that. I know my lesson. I don't use the heels too much, high heels. We benefit from the good cushion shoes because the cushion help us with not getting calluses and stuff here. Good cushion shoes, but in the like platform like this, not something like that, which the heel part is higher. So no high heels, but the good shoes with the good cushion, flat shoes with the good cushion. So we have to work on pros and cons on all of this. So what kind of shoes, what kind of insoles, what kind of exercises. So it's very important. And if we recognize the problems with the curvature of our foot, it's going to get very easy to treat that. But if we don't recognize that, we definitely cannot treat that. So first is a diagnosis. You can go to the podiatrist, we can go to the physical therapist, and try not to self-diagnose you if it bothers you, especially if it's painful. And then you can benefit from exercises if you know what it is and what kind of exercise appropriate. So these are going to be a very good home exercises for you. Thank you for watching, and I hope you could recognize the flat foot and high arch foot and how we treat them and how they can affect us and how we can prevent them and treat them and take care of them. Thank you for watching, and hopefully you can be with me on the next video. Next video will be mostly about the foot again and about different foot and ankle problems.